Statistically, you will die of heart disease, and we're not kidding. Stay with us till the end of the video to know about what you can do to avoid it. Heart disease is the second biggest cause of mortality in Canada, and 9 out of 10 Canadians have at least one risk factor for it. However, registered dietitians such as Daphne Steinberg argue that you hold the power of prevention in your hands. Now, there are many types of heart disease, and this generally refers to any condition affecting the cardiovascular system. There are several different types of heart diseases, and they affect the heart and the blood vessels in different ways. Some of the more common heart diseases include coronary artery disease, also known as coronary heart disease, one of the most common types of heart diseases. This develops when the arteries that supply blood to the heart become clogged with plaque. This causes them to harden and narrow. Plaque contains cholesterol and other substances. As a result, the blood supply reduces and the heart receives less oxygen and fewer nutrients. In time, the heart muscle weakens and there is a risk of heart failure and arrhythmias. When plaque builds up in the arteries, it's called atherosclerosis. Plaque in the arteries can rupture from blockages and cause blood flow to stop, which can lead to a heart attack. Another more common heart disease is the congenital heart defect. A person with a congenital heart defect is born with a heart problem. There are many different types of congenital heart defects, including atypical heart valves, wherein valves may not open properly or they may leak blood. Septal defects. There is a hole in the wall between either the lower chambers or the upper chambers of the heart, or atresia, wherein one of the heart valves is missing. Congenital heart disease can involve major structural issues such as the absence of a ventricle or problems with unusual connectors between the main arteries that leave the heart. Many congenital heart defects do not cause any noticeable symptoms and only become apparent during a routine medical checkup. According to the American Heart Association, heart murmurs often affect children, but only some are due to a defect. Arrhythmia. This refers to an irregular heartbeat, and it occurs when the electrical impulses that coordinate the heartbeat do not work correctly. As a result, the heart may beat too quickly, too slowly, or erratically. There are various types of arrhythmias, including tachycardia. This refers to a rapid heartbeat. Bradycardia. This refers to a slow heartbeat. Premature contractions, referring to an early heartbeat. Atrial fibrillation, which is a type of irregular heartbeat, and a person may notice a feeling like a fluttering or a racing of their heart. In some cases, arrhythmias can be life-threatening or have severe complications. Now, the symptoms of heart disease depend on the specific type the person has, and these three are just the most common. There are even some heart conditions that have no symptoms at all. That being said, these might indicate a problem. Chest pain, difficulty breathing, fatigue and lightheadedness, as well as swelling due to fluid retention or edema. Why should we care about heart diseases? Well, there are many causes and risk factors. Heart disease develops when there is damage to all or a part of the heart, a problem with the blood vessels leading to or from the heart, a low supply of oxygen and nutrients to the heart, and a problem with the rhythm of the heart. Treatments of heart conditions have a variety, and this depends on the type of heart disease a person has. Some common strategies include making lifestyle changes, taking medication, and undergoing surgery. This brings us to the second part of the video, where we talk about treatment options as well as the prevention of heart diseases. Before we go on to that though, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now, how do we prevent heart disease? Both prevention and therapy are built on a healthy lifestyle, which also serves as a supplement to medication. Daphne Steinberg says that we should start with the food options that we take, and then she recommends many of her tips for a healthier heart. Number 1, try to maintain a nutritious diet that is high in fiber, low in salt or sodium, and low in fat. In order to acquire enough fiber, eat a variety of fresh meals rather than processed ones. Try to avoid fried and processed foods as much as you can. Now, read your nutrition data table and ingredient list carefully. Steinberg advises that a low-sodium food has 200 milligrams or less of sodium per serving. To name a few things to look out for, you have to make sure that this is put on the label of the cans or the goods that you are about to consume. The maximum amount of salt you should consume each day is 1,200 to 1,500 milligrams, or about half a teaspoon. 0 should appear on the label of trans fats. You should be cautious though, as trans fat may be present in some foods even when it isn't listed on the label. Therefore, stay away from meals that include partially hydrogenated oils and shortenings. Include good fats like omega-3s in your daily fat intake limit of no more than 30% of total calories consumed. You need 21 grams of fiber daily, so choose solid fruits and vegetables as well as whole grain bread and cereals. The second tip would be to quit smoking without a doubt. You don't want to start smoking if you don't already. If you already smoke, you want to stop, because about 1 in 5 fatalities from heart diseases are attributed to smoking. Blood arteries may be harmed, heart oxygenation may be reduced, and blood pressure may be raised. Third, maintain an active way of life. For some people, that entails frequently visiting the gym. That doesn't work out for other individuals though. So, find things that are necessary and would fit the lifestyle choices that you prefer. Every day, it is advised to engage in 30 minutes of moderate activity that causes your heart rate to increase. That complements the following advice, which is number 4, to keep a healthy body weight. The key, according to Steinberg, is portion control. We do know that maintaining a healthy body weight helps to control blood pressure and lowers your risk of heart attack and stroke. Studies show that men shouldn't have a waist circumference greater than 102 centimeters, while women shouldn't have one greater than 88. Fifth and lastly, calm yourself down and avoid stress. Internal stress such as oxidative stress can be caused by external stress. Your body does respond to stimuli, and when you're anxious, your brain releases certain hormones. A number of strategies such as meditation, exercise, a good diet, and having social interactions such as playing D&D have been proven to be effective. Laughter is also beneficial. Now, we hope that you enjoyed the video. Be sure to take good care of your heart and consult your physician if you have any concerns or issues that you are currently experiencing. Of course, if you have any queries and questions that you want to be answered, let us know in the comment section below. Also, be reminded that this video is primarily for information only, and we do not claim to provide medical advice that is tailor-suited to your needs. Make sure to consult your physician to find out what type of heart diseases may run in your family or perhaps you are at risk for. Do post some of your advice and personal experience about overcoming heart diseases down in the comment section below. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later, and thank you for watching.